chapter 11, and we are going to discuss something that one way or the other, I think we hear about it. We experience some of this within the family, and we know people who have had some challenges dealing with mental health. And it's 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 a common challenges within our community. And it can be expressed in different ways depending on the nature of the mental health. First of all, we have to look at it as, or let's be able to just look at it first of all. Hopefully, after discussing the chapter, we should be able to at least understand some of the issues that, whether it's good mental health or mental illness, because there's a big spectrum when you talk of mental health. So make sure that as we go along, whenever there is a definition, try to understand the definition, because that will help. We should be able to define mental health and mental disorders and explain the prevalence of mental disorder in the United States. Two, we should be able to explain what the DSM 5 is and give an example of its limitations. Give an example of how cultural differences can impact the diagnosis of mental disorder. Four, cite specific examples of the causes of mental disorder. Five, define stress and explain its relationship to physical and mental health. Six, briefly trace the history of mental health care in America, highlighting the major changes both before and after World War II. Seven, define the term deinstitutionalization and list and discuss the focuses that brought it about. Six, describe community health, mental health centers as alternatives to state psychiatric hospitals. Identify the major problems faced by people with mental illness who are homeless. 10. Describe some legal and practical issues affecting how society should deal with problems of mental illness and violence. So these are all very, very, very important goals or objectives. Now, describe mental health court, outpatient commitment, and the use of legal leverage and compel treatment. Describe the challenges facing law enforcement personnel when dealing with community residents who are struggling with acute symptoms of severe mental illness. Define primary, secondary, and tertiary preventions as they relate to mental disorders and give an example of each. So you can go down the list. It's a lot to be discussed. And introduction to mental illness is one of the leading causes of disability in North America and Europe. People showing mental illness cannot function effectively, and it's a disability. And some of those disabilities, some of them can be adequately managed, and the workforce can make accommodations. Some of them, they cannot. 20% of American adults have diagnosable mental disorders during a given year. Especially in this changing world, wherein things are happening every day. Some people are being challenged just because of the demographic shift in this country. Develop some level of anxiety and act it out. And some out of a job can lead to a certain level of mental disorder. Loss of a family, broken up relationships. See, these are all things that if people don't know how to handle some of those things can grow and become something very serious. And out of this, only 38% receive treatment. See, some of it require medical treatment. Some of it just requires some good counseling. You see, because it's not all medical illness that really requires medical or medical treatment. Some of it is just proper counseling, proper, better way of looking at the issue that they are faced with. Look at better alternatives. Needs of people with mental illness diverse. Services required to meet needs include therapeutic and social services. The therapeutic, that's medication in most cases, and also some form of social services to help people really deal with their everyday activities. Now, this is a list of disability. When you talk of all ages in the United States, Canada, and Western Europe. Through, so this was to 20,000. Now, mental illnesses were talked, considered number one. And most of the time, I think, why? So many changes taking place. There are a lot of opportunities in the Western world, but at the same time, some of those opportunities at times, it's only few people that can really experience those opportunities or can attain some of those opportunities. And also, there are a lot of drugs. Those are all possible, can lead to mental disorders. And yes, since public health has announced that racism also contributes to mental illness, that's also an issue because racism changes people's perception of themselves. When they have been faced with racial issues, they stop believing in themselves. Some of them develop source and low self-esteem, and for some they cannot even function. You have alcohol and drug use because of some of those challenges can contribute. You have Alzheimer's, you have the musculoskeletal diseases, respiratory diseases. Now, these are all the mental disorders. You come to diabetes, migraines, and other disabilities. But top all is mental illnesses because each of these other diseases also can have an element of mental. How do people deal with some of those injuries? Can deal with some aspect of mental illness. Definitions: mental health, emotional and social well-being. See, that's one form of mental health, but again, short form is emotional and social well-being. But mental health also is a state of success. People in good mental health, they are in a state of successful performance of mental functioning, resulting in productive activities, fulfilling relationship with other people, and the ability to adapt to change. and cope with adversity. So one of the things that the COVID virus has also introduced into the world. Some people have been mentally disturbed, that have made them not been able to function properly, not been able to function in good relationships, maintain good relationships, because of the destruction that this COVID has brought into the world, into different countries, into different communities, and yes, into America with all of her resources. There are very, very few families that can say, okay, this has not either impacted them directly or indirectly. And some people might not be able to cope. Characteristics of people with good mental health include possessing a good self-image. When you talk of the social well-being, people possessing good self-image, having positive feelings about others, and in being able to meet demands of every day. So these are all things that are extremely important when you're dealing with mental health, people's emotional and social well-being. Are people able to function emotionally? And can they form relationship, healthy relationship, and can they perform in a healthy social environment? See, because these are all things that when we talk about health with all its attributes, health is very, 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 very important. Then you have the mental illness, all diagnosable mental disorders. And there are a lot of them as we move along with the lecture. We talk of mental disorders, health conditions characterized by alterations in thinking, mood, or behavior associated with distress and or impaired functioning. Good health. When you say this person has good mental health, when this person is in good mental health, has adults with good mental health are able to function under adversity. So these are people with the knowledge that life is full of challenges. And to succeed is you do your best under these challenges. Look for other alternatives, look for other options, but don't give up, because you give up due to one challenge, there is another challenge that is going to show up. So therefore, it's always good for people who are able to function under adversity. They show good mental health. I say because one of the things that people who can function properly under adversity are people who are also willing to ask for help, seek other possible solutions, and have a positive attitude. Don't easily assume, oh, because most of the time also, that's why even when I uh, talk to my students, when you are faced with challenges, don't just right away go, oh, especially if your supervisor is a white. Go, right, oh, it's because he's racist. Well, maybe not. See, assumptions most of the time are not the best way to deal with issues. You try to work it out. When it persists, then there are ways that you can deal with those solutions. But don't just assume that because I'm faced with challenges, therefore it's somebody's fault. At times we have to also be willing to own our fault, because we cannot grow if we don't admit our faults. Change or adapt to change around them. Said, things are changing. We had to adapt to online teaching. Online teaching is not my preference, but because of the challenges, because of changing, we had to adapt. Because I like to engage my students. I like to see the faces of my students. I like to engage them in discussion as the lesson progresses. But again, all of us have to adapt, because not being able to adapt creates more problems for us as students and as young adults. You always, whenever there is a change, try to know why and seek possible ways how you can adapt to it, and see what are the advantages by engaging in different approaches, because you will find out that at the end you might like it. So change is never bad. It's not always as bad as we think it is. But if you do it for the right reasons, it's always good. It helps you to grow. maintain control over their tensions and anxieties. So the ability to maintain your composure, your tensions. Life can be stressful at times, but the only way you can really be fruitful is when you are willing to adapt. See, when you are willing to adapt, you are also willing to making sure that okay, try to find out what are those stressors, what are those things that create this anxiety. Because most of the time we will have to know ourselves. What are the things that makes us really anxious? Then when you are able to deal with that, you are really dealing with good mental health. Maintain control over their attentions, find good satisfaction in giving them, in giving than receiving. So there's beauty, according to us, it's always when you can give, when you can share. First of all, there is a feeling of, there is a common bonding between human beings when people can help each other. When those that have can share with those that don't. When people can willingly give what they have, it gives them much more joy. Show consideration for others. Have empathy. Try to walk in others' shoes. See, people with poor mental health do not have that ability. But people with good mental health have that empathy. They show consideration for others. Curb hate and guilt. Curb racism. And guilt. Try to do your own part to reduce racism. All those tenets, those attributes that through miseducation have created this idea of this racist kind of tendencies. People thinking more better than people thinking that they are better than others. Or just hate them because of who they are. See, people with good mental health don't do that. They curb, they reduce hate and guilt. Here, love others. Again, here, people with good mental health, they not only say love your family, love your friends, love your people within your same group or same racial group or your neighborhood. No, love others, everybody. Love the human race. You see, because the world has gotten this far because of people with good mental health. the contribution of people with good mental health. A good amount of destruction that goes on in the world, if you take time, you'll find out that there are some mental issues that could be addressed appropriately. Classification of mental disorders. Now, this was something that was put together by psychiatrists. The Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, the DSM-5, DSM 5th edition. Now, this was published by American Psychiatric Association. And this is the most influential book in mental health. Classifies disorders based on behavioral signs and symptoms rather than definitive test or measurement of brain or other body systems. Challenges to diagnosis include comorbidity and lack of cultural competence. And most of the time, these are some of the issues that we are dealing with, even when we're dealing with the justice system. There are certain comorbidities that, when not properly taken into consideration, people respond or people engage in situations that are not proper, especially when they're dealing with the legal system. The relationship between police and the people they are expected to police. I think there has to be a lot of cultural understanding and ways to be able to address issues or to address stressful situations when they occur. Instead of escalating those, you de-escalate the situation. Don't make it worse. Try to deflate the situation. Bring the temperature down instead of turning the temperature on. Causes of mental disorders. You have symptoms, can arise from various causes. Sometimes poor parental care goes a long way. Poor prenatal care, and also postnatal environment, genetic, environmental factors, brain functions, impairment, substance abuse, maladaptive family functioning. Then you have stress. So some of these possibilities, and remember when we were talking about the health of the infant, when there is poor prenatal care, you see the ramifications. Prenatal, before birth, this is inside, things that goes on inside the womb. When that child, what sort of environment is that child born into? And at times also mental is genetic. What are some of those mental issues or conditions that are common within the family? The environmental factors, some social factors, physical conditions, the housing situation. How does the brain developed? Not only the brain function, but the brain function impairment. What are some of those chemicals that affect the impairment of the brain to function in a healthy way? Then you have the old culprit, substance abuse. Illegal drugs. At times, some are also legal drugs. How much contributes to people's mental health? Maladaptive family functioning. The nature of the home. At times, what sort of home? Is it a mentally healthy home, or is it a mentally ill or maladaptive functioning? Stress. Stress in itself is not bad issue, because stress is what gets us do things we like. It's a form of motivation in itself. But when stress overcomes our ability to function properly, a distressful situation. Now you have the PTSD, which some years ago people will not talk about some things like this because these are the post-traumatic, disorders that people, especially people that have gone to war, have seen what has happened, have seen the destruction of others. And they come back and the mind is like an ongoing video playing. And that can just lead them to just paralyze them from being able to function. You have stress, a contemporary mental health problem. So you have stage of alarm, stage of resistance, stage of exhaustion, all normal state when it goes straight. Stress is one's psychological and physiological response to stressors. Now, stressors are those things that just makes us stress. Exams, college, paying for this, paying for that, boyfriend, girlfriend, owning a house, paying your rent, not being sick by COVID. So these are all the things that can really get people really stressed out. And if people are not being able to address those things, it can escalate to problematic situations. Now you have the fight and flight reaction. When something suddenly happens, your adrenaline kicks in. You're ready to fight or flight reaction. Okay, you have some situations of diseases of adaptation. And experts recommend combination of physical, social, emotional, environmental, and psychological approaches to managing stress. So these are all extremely important. Physical, physical environment, the physical situation, social, your interaction, your relationship issues, and environmental, where do you live, and your psychological approaches to managing stress. You have to have the ability. Some people say you pause, you breathe breathe deeply, take in and release. And at times also, once you know the stressors, you stay away from those stressors. See if you can possibly remove yourself from those stressors. Because there is a level of accountability that you have to take, First of all, know whenever, okay, sit down and say, okay, how does this, knowing this person or being in this environment, how does that makes me feel? If that makes you feel uncomfortable and just don't like it, don't go there. Don't go there. Some you have control, others you don't. But those that you have control, take charge of those control. And those that you don't have control, seek help. Let professionals help you through the process. Suicide and substance abuse. Now, suicide and substance abuse, like recently the opioid, it led to an unexpected rise in death rates among middle-aged white Americans between 1999 and 2014. say, overdose of substance abuse. So many chemicals out there, people self-medicating. So when you have an issue, the best way is seek help. Using drugs is not a cure that is going to help you. Work with professionals. There is no problem worse than the way you think about it. Because if you go seek help, trust me, you thought, okay, there was not going to be another day. You'll find out that there is going to be an even better day, but you seek help. And suicide and substance abuse have increased simply because the prevalence of alcohol and other drug abuse, a social indicator of mental illness problems. Too much alcohol, too much drugs. And when those things are in our system, some people either go alcohol and combine them with other drugs, just creates a havoc in our mental ability to function. And the next thing, some people don't even know when they are committing suicide or drug poisoning, hazing, taking too much drugs, too much alcohol in a very, very short period of time. So this is common. Among certain groups. See, drinking alcohol appropriately is okay because alcohol is used in various functions of our cultural setting. It's the amount and the time it takes you to consume the amount that can be problematic. Drug use, depending on the type of use, if it's prescribed drug, use it as it is prescribed. If it's not prescribed for you, don't use it. You are abusing it. And once you abuse it, that can, if you don't watch out, it can take you out. Okay, so we'll stop here for today and we're going to continue the next time with the next lesson.